Welcome back. All hour, we've been talking about millennials and their midlife mindset. And health, of course, is an important part of all of our lives in this conversation. According to the National Institute of Health, cancer diagnoses are rising in people under the age of 50 at an alarming rate. And in the next decade, colorectal cancer is expected to become the leading cause of cancer death in people ages 20 to 49. Our next guest, Candace Henley, was only 35 years old when she was diagnosed with stage 4 colon cancer. Over 20 years later, after a brave battle, she is now a cancer survivor who has made it her mission to help educate others. Please welcome Candace and medical oncologist and colorectal cancer expert, Dr. Kathy Ng, here in partnership with Pfizer to the show. Thank you so much for joining us.
Thank you. Thank you.
Thank you for having us.
I mean, Candace, as they say, you have a testimony.
Yes.
You were a single mom, 5 daughters.
Yes.
One was just 4 years old when you found out you had cancer.
Yes.
You say you just wanted to see your youngest turn 18.
Yes. I was at a moment of despair, and I was misdiagnosed for 6 months. And it wasn't until my 3rd trip to the emergency room, even after presenting with symptoms of tiredness and not be able to catch my breath. And the last thing that took me to the emergency room was not having had a bowel movement in over 2 weeks. Wow. And I still wasn't, no one asked any questions. And finally, I was diagnosed with colorectal cancer. And it was a shock. Because I was 35.
Yeah.
And it was not something that I was expecting at 35 years old. And I'm a mom of 5 kids. Who's going to take care of my 5 daughters? And it was at that moment where I was in despair. And it's just like, God, if you just allow me to see my 4-year-old turn 18, I'll do everything I can to raise awareness of colorectal cancer and save others from what I've been through.
It's so interesting, Dr. Ng, the recommended screening age for colorectal cancer has gone from 50 to 45 to help detect the disease earlier. Why was this so important of a change?
So Candace's story is a story that I hear frequently in my clinic. Colon cancer is one of the most common cancers in the United States, and it's the 2nd leading cause of cancer death for men and women combined. It is rising in our young adults that are less than 50 years of age annually. And a lot of our patients are presenting with more advanced disease because they are often misdiagnosed or have a delayed diagnosis.
Yep.
And so that's why it's critical that all patients learn about their family history, or if they have a family history, please get screened.
Yeah.
And if you have symptoms that are unresolved, please go to your doctor and get some advice and really learn about your family history and touch base with a provider about your symptoms.
And that's a major point in Candace's story, because it wasn't until 11 years after your diagnosis that you discovered there was a history of colon cancer in your family.
Yes. And being a 21-year survivor now, that's what my advocacy is. It is to encourage people to learn their family history and to talk about it, because we're a family full of secret keepers. And so I always say family secrets kill families, because we're not having these discussions about diseases that run in our families. And so that's what's killing our family lineage. And so being a survivor, this is what my advocacy is to encourage these conversations.
So important. Dr. Ng, you encourage people to advocate for themselves when talking with your doctors about your symptoms. What are the questions that we need to ask?
I think Candace's story is really important because she knew something was wrong and she went back again to the doctor. So it's important, if you are dissatisfied with basically a provider giving you the opinion that you think should be provided, go get a 2nd opinion, go get a 3rd opinion. That's fine. That's the most important thing. if your symptoms are unresolved, it is so important to touch base with a provider. And then the second most important thing is that once you're diagnosed, you need to have biomarkers completed, because biomarkers can make a difference in learning about your cancer. It can serve as a preventive factor for your family members. It can teach you about what treatment to be provided to your patient, as well as the sequence of therapy. And biomarkers can be obtained in blood or tissue. They're genes or proteins or various alterations that impact your cancer. And there's common key biomarkers that we order as physicians. One is called microsatellite instability, which may be associated with a familial form of colorectal cancer, KRAS, and then the BRAF mutation. And the BRAF mutation is much more aggressive colorectal cancer tumor type, so it's of critical importance. And I think it's really important to recognize that there's a lot of ongoing research and there's a lot of hope in the future for patients with colorectal cancer.
Well, this is a living example of hope. Really on the right team at the right time. Thank you. How are the girls? I got to ask you, how are your girls?
They are great. My youngest is now 25.
Thank you to Candace, Dr. Ng,